All right. So here we are today with Dr. David Hill, and I'm going to let him have a chance to introduce himself. But first, I want to thank him for not only his work in the healthcare profession, but also taking the time to speak to us today and speak to the public to keep us all informed about the ongoing COVID-19 crisis in Connecticut. So I'm going to let Dr. Hill take a minute or two and introduce himself.
Sure. So I'm David Hill. I'm a pulmonary and critical care physician. I practice in Waterbury. I'm in private practice, but I'm a faculty member for the Yale School of Medicine, along with the Quinnipiac College of Medicine. I spend most of my time at Waterbury Hospital, sometimes at St. Mary's Hospital, and a lot of my time in my outpatient practice.
All right. And lately, you've been spending a lot of time keeping the public informed as well. I know you've done some local interviews and even some not local interviews as well.
Yeah, so I have been a volunteer for the American Lung Association for years. I'm a national board member and a national media spokesperson. I started out when this pandemic was hitting by posting some stuff on Facebook that, no pun intended, went viral, and felt the need to continue to share truthful scientific information because there's a lot of bad information out there.
Absolutely, absolutely. Well, thank you so much for taking the time to share some of that good information with the public today. So my first question for you is, how would you rate Connecticut's response to the COVID-19 pandemic? There's a lot of competing statements online, a lot of competing opinions in the kind of political sphere where I'm from. And, I tend to think that I think the governor has handled it reasonably well, but I'm wondering what the opinion of a healthcare professional is.
I think in general, we've done well in Connecticut. We're geographically unfortunate in that we're squeezed between New York and Boston, and being right on the border of New York, particularly for Fairfield County, was a challenge. I think the entire country responded slowly to this, and there was a lot of mixed messaging when the coronavirus began to circulate here, and that delayed everyone's response. But we shut schools fairly early. We shut down fairly early in order to flatten the curve. We have done a reasonably good job of getting protective equipment to healthcare workers. I think things were a little slow in the beginning, and then the State Department of Health and the Connecticut Hospital Association worked hand in hand to make sure equipment was where it needed to be, ventilators were near where they needed to be, and even though we were hit hard, we never got overwhelmed like New York did. I think if you could make fault with anything, the state has done, it might be in how they handled the incarcerated population.
Right.
I know some of my colleagues have been really concerned about people in jail for nonviolent offenses who are living in close quarters and not adequately being protected for the virus. But in terms of the general public, we've done a really good job of protecting people.
Well, that's really great to hear. And that kind of leads into my next question, which is, how do you think our state and region could have been better prepared, or even better prepared to handle this kind of a crisis?
So I think I mentioned communication. I think if there had been clear early communication from the national leadership, the states across the country would have prepared better. I think we're learning from this epidemic, and we have had, other epidemics during my professional career, H1N1, about 10 years ago, the HIV epidemic, but this is different. We haven't faced anything like this since probably 1919.
Yeah.
So we will learn a lot from this in terms of modern medicine. I think we'll learn to stockpile protective equipment and things like ventilators. We'll learn that earlier clear-cut communications leads to better outcomes. In Connecticut and nationwide, it's still sort of every hospital system for themselves. So when
Right.
you need masks for your doctors and nurses and frontline staff, when you need ventilators, when you need medications, you're out there competing against the hospital that's a mile away, or the bigger healthcare system that has more money. And there needs to be a more equitable distribution, and also a way that it goes where it's needed, when it's needed. This virus is hitting the whole country, but it's not hitting each place at the exact same time. And there are ways we could have handled that better. The price of all the protective equipment has skyrocketed, and some of that is just supply and demand. But if we had a stockpile available, we could control things better at a better cost. And it's to some degree, unreasonable to expect every healthcare system to purchase their own stockpile of equipment because they won't be able to afford it.
Right.
So we need to have it out there, ready to use and ready to move around the country, which is something public health people have talked about for years and has been underfunded by multiple administrations.
Absolutely. So, there's been a lot of talk about beginning the reopening process. And I actually just saw right before this interview started that the governor has now rescinded the call to open up hair care and hair salons. But there's still a partial reopening plan to begin on May 20th. And I'm wondering if you think, number one, that's an appropriate time frame and we're moving either too slowly or too fast. And what do you think the likeliest scenario is for how the rest of the virus might play out throughout the rest of 2020?
So I will say I don't think it's too slow. And I'll say that I'm biased because I'm a pulmonary critical care physician and I see the people who are sick and dying from this virus. I think the key to reopening comes down to testing and then quarantining people who are actively sick and contact tracing people they expose to the virus. That's what South Korea has done to keep their disease rates down really low. They actually had an outbreak over this last week that they confined to about 15 people by just repeating what they did initially. They tested everyone who came into contact with those people and shut it down. So we can reopen safely if we can test well enough to identify the virus and stop it from spreading. And there are going to be some activities that are just lower risk than others. You or I going to the grocery store probably has some risk, but if we wear a mask and do our best to distance ourselves from other people as much as possible, it's not that high a risk. Going into a dental office is a high risk thing for everyone because the patient has to have their mouth open. The dentist or the dental hygienist is being exposed and spraying stuff all over the office. That's much higher risk. The hairdresser is a good example. It's hard to cut somebody's hair. Excuse me.
No worries.
It's hard to cut somebody's hair without getting close to them. And sure, if they have proper protective equipment and take precautions, it might be able to be done safely, but then it depends how many people are getting their hair cut in close proximity.
Right.
What other things are they having done that might be spreading virus around? It's not simple. Restaurants are another example. How closely are people seated together? And what's the ventilation like? So if you're 8 feet away from somebody, but the air is blowing through you to them, it may be still a risk.
Right. So do you think that over the course of the rest of the year, Connecticut is likely to see a resurgent wave of COVID, or do you think it's likely to taper off slowly over the rest of the summer? Or is it just too early to say?
A little bit too early to say. I think what we've seen locally is we had a peak about a month ago, and we've had a downtrend, but it's been slow. And I'm not sure if it's just simply sort of plateauing. I expect we're going to have waves where cases increase as we open things up, particularly if we don't really test well. I don't think in Connecticut it'll get as out of control as it could, because I think the population in general is listening and we have strong leadership. I think in the country, we're going to see areas that have much bigger waves because the political leadership does not have the will to support the public health steps that need to be taken.
Right. So in my district, Waterford and Montville, we've been inordinately impacted by the virus, in large part because we have a lot of older communities. We have a lot of nursing homes, convalescent homes, retirement communities in this area. And Southeastern Connecticut as a whole has really been kind of the hotbed in the eastern half of the state. And I'm wondering how well Connecticut's healthcare workers have been protected. I know that there's been talk about how Connecticut's better than some other states, but also there's people protesting down in New London over issues of not having adequate protection. I'm wondering, how well are our healthcare workers protected, and what can we do to support them?
So I think it depends on what type of healthcare worker you're talking about.
Right.
I think in our hospital systems, the healthcare workers are fairly well protected, but it varies hospital to hospital. I work in two hospitals. One of them has a better supply of protective equipment than the other, and there's been varying rates of disease in the healthcare workers in those two systems. The nursing homes, that subacute and extended care facilities, have lesser supplies of protective equipment, and their budgets are tighter even than our acute care hospitals, which run fairly tight budgets as well. So one of the things we're seeing is a high rate of disease in those institutions, both among the patients and the people who work there. We have to assume, because they've cut down visitors being allowed to go in, that it is the workers who are bringing the disease into the nursing homes, and then because they don't have adequate protective equipment, they're giving it to the patients, and then it spreads. So one of the things we're going to learn from this is we have to adequately supply protective equipment to those facilities in order to prevent an outbreak like this. I think your region of the state is similar to the Waterbury region, where we've had a number of outbreaks in nursing homes. About half of our deaths have been in nursing home patients. They're at high risk for this virus, and they don't do well when they become critically ill.
Right.
And I'd assume having the two casinos down there probably isn't helping the economy either. It's another area where people have to gather together closely. It's not an ideal place for a virus to be.
And so to that point, my next question is, what sorts of policies could a future legislature enact to move Connecticut towards being prepared for future waves of the virus coming back, or for the next pandemic?
So I think preparation is going to be one focus. So how do we ensure that protective equipment gets to the right place at the right time? Budgeting for the public health system so that we hire the sort of feet on the ground. In order to do the contact tracing and quarantining, you need people power. So we need to hire more public health personnel, or at least have the ability to temporarily hire those people when we need them during an epidemic or a pandemic. I think budgeting for how we take care of the elderly, particularly those in nursing homes, patients in other congregate living facilities like group homes, and making sure there's equipment for the people who care for them is going to be important. And then I think one of the things Connecticut has done as a positive is we've worked hand in hand with other states in the region.
Absolutely.
So continuing to set up that infrastructure. If we can't count on the federal government to control things from a national standpoint, we need to band together regionally. But I think the reason we have a Center for Disease Control and a National Institute of Health with billion-dollar budgets is to take the lead in these situations, not to rely on each individual governor to make all the decisions.
Right. So what advice would you give to our state lawmakers or our future state lawmakers as Connecticut begins the path to economic recovery and eventual total reopening?
So I would say take things slowly, be prepared for setbacks, and really look at our budgeting priorities. It's going to put a major stress on a healthcare system which is under stress already in this state, and we have to figure out how we can recover from this and keep people safe. This is no easy process. So I think it's going to require intelligent, thoughtful leadership, and I think when we're looking at who we elect, we want to elect people who believe in science.
Yeah, absolutely. Well, my final question is actually right to that point, and it is, how can we combat the massive amounts of misinformation that are being spread via social media or even through major news sites? It seems like every day I turn on, Facebook or what have you, and I see articles that, are even being shared by reputable sources that really have no basis in fact. And I'm wondering what we can do to keep people better informed.
Yeah, I think as a nation, the media and the general public will learn a lot from this pandemic, and the scientific community as well. There is a rush to release information, to publish research studies that have not been reviewed or well vetted. and then for the mainstream media to put out articles with headlines that imply more than has really been learned. So I think in terms of the lay public, before you share something, try to vet it and determine whether it's true. I have a lot of friends and acquaintances who will share things and say, well, this seems interesting.
Right.
The internet is a powerful tool. A lot of times before you share, you can determine whether what you are sharing has a basis in fact or not. And spreading things that might be true or are just blatantly false doesn't do anyone any good. I see a lot of people posting, I don't know what to believe. And that's not what we want in our society. And I honestly think there are some people who have alternative motivations that are sharing poor information because they don't want people to know what to believe.
Right.
So don't just share everything someone else shares, every conspiracy theory, every video of some physician in their kitchen wearing scrubs telling you they found the cure to coronavirus.
Absolutely.
If somebody says they've found the cure, or this is the reason the healthcare system has been doing everything wrong, I can assure you that they don't know what they're talking about.
Right.
I think we need to be careful when we release things to the press as a scientific community, and the press has to be careful not to imply more benefit than there is. This is the first time I've ever really seen our leadership in this country promoting therapies that are experimental and unproven.
Right.
And it's not that there aren't medicines that may be helpful for coronavirus that should be exciting the scientific community, but we shouldn't be promoting false hope. We should be working towards finding effective treatments through good science. We should be working to develop a vaccine through good science, and we should be taking care of patients with the best care that we know works during the current time.
Absolutely. Well, Dr. Hill, I want to thank you for taking the time to share your insights with the public and helping me keep the public better informed as my role as a candidate and as a local elected official. So I thank you very much, and thank you for the work that you and your colleagues are doing on the front lines.
Sure. Appreciate you taking the time to speak with me, Mr. Welch-Collins.